Hi, Dr. Pelto here. Today I want to talk about a question that a patient asked me. This was a patient that I saw in the office recently. When I have an ingrown, what do I have to do, or what should I do when I have an ingrown toenail to the base of the toenail? Let me give you a little backstory of this patient. This patient was a 20-year-old male, and he was a wrestler in the university. He liked to wrestle. And what he found is that his toe kept on getting jammed on the wrestling mat. And he tried to treat this nail himself, and he thought the ingrown toenail was on the sides. He was trying to trim out the sides. You can see, look at how far he went down into the edge here, both on this the outside and then on the inside of the nail. And what you'll see at the tip of the toenail right here, this is a bulbous change of the toenail. When the toenail grows out normally, it holds down the skin, but in his case, it developed this bulbous thing at the tip of the toe. And this really wasn't the problem when he came in. The problem wasn't an ingrown toenail on the sides. Ingrown toenails can happen in actually 4 different places, if you believe it or not. One of the 2 most common are the 2 sides. So it can happen on this side. It can happen on this side. If you have that bulbous change at the front of the toenail, it can also happen at the front of the toenail. But in this case, which isn't all that common, he developed an ingrown toenail at the base. And the reason I can tell that is the base of the toenail right here, it was actually, I could see the nail almost sticking through the skin here at the side. And there is all of this red tissue at the base. Do you see how it's red? How there's no real skin lines? You can't really see the skin very well. Everything is swollen. This has a little bit of an irritation and maybe a little bit of a pus in there. When I took off the nail in the office, it didn't really have pus, but it was just irritated for a long time. This isn't going to get better on its own. In my opinion, you can leave it for months and months. It doesn't really get better because of all this injury. And so what's the resolution to this ingrown type of a toenail at the base? Well, the way to treat it is to remove the toenail. It's a pretty easy thing to do. You numb the toe back here. So there you put 1 needle here and 1 needle here at the base of the toenail. Once the nail is numb, then you just pull off the toenail. It comes off pretty quick, and then you clean everything else around it. And then it feels better in about 2 or 3 days. I put a bandage on it. There's no need for antibiotics in this case. I didn't think there was an infection, and the new nail will grow back. Hopefully this new nail will grow back normal for this patient. I'm not exactly sure. And I hope it'll grow back normal. It could grow back a little bit thickened. It could grow back ingrown. But this type of an ingrown toenail to the base isn't all that common. I would say maybe 2% or 3% of the ingrown toenails we see happen from this. I see this many times when patients have a longer toenail and the toenail hits the front of the shoe. So for example, let me give you an example. Your toenail hits at the front and then it buckles. It buckles like this, and then it pushes backwards. When it pushes it backwards, that causes this jamming motion into the back of the toenail. So that's what happens with this patient. And we took off the toenail, and he's going to be just fine and able to continue his career in wrestling. I'm going to put a couple of links here. I'd like you to, first of all, subscribe to this channel. If you haven't subscribed, that always helps me. And put a comment underneath it. Let me know any questions that you have, anything that hasn't really been explained well. That's where I get the ideas for many of the videos. Also, I'm going to put 2 videos on the side here. One of the videos is going to be an ingrown toenail course I have. Basically, it's just one web page with everything you want to know about ingrown toenails. And then also some other helpful videos that you might find helpful if you liked this one. Okay. Once again, hope you guys enjoyed this.